Here we have Steve Payne, Dr. Payne. I'd like to introduce Dr. Steve Payne. He's president of the National Guild of Acupuncture and Oriental Medicine and vice president of the Connecticut State Chapter of Guild 62. Guild 62 is a member of OPEIU, which is part of the ACL. Steve is a doctor of Oriental Medicine, a listed Chinese medicine practitioner in Hong Kong, where he practiced for 18 years, a licensed acupuncturist in Hawaii and Connecticut. Dr. Payne and Guild 62 are leaders in the efforts to integrate the best elements of Western and Eastern medical care to optimize health, to respect patients' choice, and to reduce healthcare costs. So let's give a warm welcome to Dr. Payne.
Thank you very much, John, and a special thanks also to Mike Goodwin, who's the president of the OPEIU, for helping get me here. I'm really honored as a Connecticut born and raised, but left for 40 years and came back with my young family because I believe in this place. And you get a new perspective when you're away for a long time. Well, I've been asked to answer two questions. The first is, how in the world did a bunch of needle-happy acupuncturists wind up in the Connecticut AFL-CIO? And the second is, what can we do? How can we be of use to the leadership and the brothers and sisters of the AFL-CIO? Well, first of all, how we became part of the AFL-CIO. The answer lies in our awareness of the power and the influence of organized labor, followed by our seizing the opportunity to become a part of it. Since its earliest roots 125 years ago, the AFL-CIO has been the single most effective force in America for enabling people to build better lives and futures for their families. In addition, the AFL-CIO has been the driving force behind national and state initiatives to provide health care cover for all Americans. Our guild began 12 years ago because a California supporter of acupuncture, a senior union representative with the Department of Labor, and a handful of our practitioners recognized these facts and decided to seek affiliation. As luck would have it, about the same time, the OPEIU brought a federal lawsuit to establish the right of medical professionals to organize as independent contractors. The OPEIU won that lawsuit, and the National Guild of Acupuncture and Oriental Medicine was born. The American Federation, a couple of words about the OPEIU. The American Federation of Labor chartered the Office and Professional Employees International Union in 1945. The OPEIU now has 110,000 members in 55 local unions and guilds, functioning in all 50 states, Puerto Rico, and District of Columbia. Other medical professionals affiliated with the OPEIU are physicians, nurses, optometrists, pharmacists, podiatrists, and clinical social workers. We have found that by partnering with the OPEIU, we have been provided with strong legislative and lobbying power and greater access to patients by virtue of our potential, and that potential is emphasized, inclusion as providers in union health plans. So we joined the OPEIU and its powerful parent for what it could do for the members of our profession. And we've been very thankful for the benefits that have accrued to us. In return for what we've received, we are dedicated to helping all the members of the AFL-CIO and their families enjoy fuller, healthier lives. So I'd like to tell you what our Guild of Acupuncturists can contribute to you. Number one, our profession can help fix a very big problem. And that big problem is the American healthcare system. Healthcare costs are rising at roughly 5 times the rate of inflation, and the costs are shifting from employers to employees. Consumers are using more prescriptions at younger ages for more conditions and substituting newer, more expensive medications for the established products. As a result, pharmaceutical spending is increasing between 15 and 17% annually. So how can we fix our healthcare system? Well, one approach is to pay a whole lot more attention to prevention and early intervention, and to alleviate pain and restore function so that injured workers can heal faster and return to work earlier. This is what our profession does, and what it does better than any other medical profession. Let's take a look at the high cost of healthcare, what brought it on. Our healthcare system is really a disease management system. It focuses on disease care rather than prevention and health promotion. Research has shown that 50% of the deaths in America and 70% of the disease is self-inflicted and is caused by an epidemic of unhealthy habits, including diet, exercise, and attitude. Yet we spend only 1% of our healthcare budget on prevention and early intervention. It makes no sense whatsoever. So what's the evidence that what acupuncturists do works? Well, we have a number of studies that demonstrate that disability is reduced by up to 40%. Days in hospital reduced by up to 50%. A good example is heart bypass surgery, in which a study conducted with a large pool of people showed that 80% of the people eligible for bypass surgery or angioplasty were able to avoid it completely by making comprehensive lifestyle changes. Mutual of Omaha calculated the savings of more than $30,000 per patient. And these patients reported reductions in angina pain and heart pain comparable to what could be achieved with bypass surgery. And they did it for almost nothing. So how can acupuncture directly help union members at work? Within the work comp system of California and Hawaii, where I studied and worked, we have consistently accelerated the healing time of workers, helping them get back to work quicker. We demonstrated to the state of Hawaii that by using acupuncture in tandem with other Western medical approaches, we were able to significantly cut the cost of care for injured workers and provide a healthier individual. In my own experience running the medical acupuncture division of a large occupational medical facility in Hawaii, we managed to relieve the pain of seriously injured workers who had been out of work for more than a year and get them off the pain-killing drugs that were destroying their lives and the lives of their families. We have proof positive that acupuncture works and that Americans love it. A survey conducted by Claire Cassidy, a medical anthropologist and a researcher, demonstrated that 93% of the people who were users of Chinese medicine, of which acupuncture is the primary modality, 93% of those folks said that they were satisfied that the issues for which they sought care were successfully resolved. 71% stated that they missed fewer work days. 64% stated that they performed better at work. 84% say they were able to reduce office visits to medical doctors significantly. 79% said that they reduced the use of prescription drugs. And most importantly, 70% said that they were able to avoid the surgery which had been recommended for them. Now, that's astounding. The cost savings are remarkable. So in conclusion, the AFL-CIO and its member unions have driven healthcare expansion and reform in the U.S. for more than 100 years. That effort has been sustained by harnessing the creative power of diverse working people. Acupuncture came from the Orient, but it has become uniquely American in its application to our personal and work-related health. The National Guild of Acupuncture and Oriental Medicine is committed to helping the AFL-CIO expand and reform healthcare for workers and their families for the next 100 years. Thank you very much for your attention.